And it's over to Dr. Ringle to moderate the English session today. Welcome, Doctor.
Yes, sir. Good evening. A very warm and heartfelt welcome to one and all, respected dignitaries, esteemed teachers, distinguished doctors, research scholars, students, and homeopathy lovers from across the India and around the world. Welcome to the 2158th day of the uninterrupted daily webinar of the International Forum for Promoting Homeopathy IFPH. I am Dr. Rinkal Advaryu and it's my privilege and honor to be your moderator for today's enlightening academic session. The International Forum for Promoting Homeopathy, popularly known as IFPH, is a global humanitarian organization dedicated to promoting and strengthening the homeopathy by bringing together homeopathic professionals, educators, researchers, and students under the one platform beyond regional, religious, political, or ideological differences. IFPH remains committed to the advancement of the homeopathy through the continuous academic activities. Today's webinar promises to be a highly informative, especially for everyone interested in women's health and evidence-based homeopathic practice. It is now my great honor to introduce our respected guest speaker, Dr. Chhaya Patil ma'am, MD Homeopathy and PhD scholar, is the professor and head of the Department of the Gynecology and Obstetric, housed by Homeopathic Medical College and Hospital, Kolhapur, Maharashtra. Ma'am has been remarkable contributions to homeopathic education, research, and women's healthcare. We are truly grateful to have you with us today to share your valuable knowledge and clinical experience. So, the today's topic is homeopathic management of menopausal syndrome and experimental non-controlled study. Menopause is a natural transition in every woman's life, yet it can significantly affect physical, emotional, and psychological well being. Through today's session, we look forward to understanding the research methodology, clinical observation, homeopathic management, and outcome of this important study. Before we proceed, I request to all the participants to kindly keep your microphones muted on throughout the session. Join with your full name and keep your video open if possible. Note down your questions and there will be an opportunity for discussion at the end of the lecture. Now, without taking much of your valuable time, it is my proud privilege to invite our speaker, Dr. Chhaya Patil ma'am, to deliver today's lecture. Ma'am, the virtual stage is all yours. Welcome to IFPH, madam.
Yes, my topic is actually menopausal syndrome. Role of homeopathy in
It's not
menopausal
visible.
syndrome.
No, it is not visible.
Yes,
Yes. You can put it in slideshow.
slide.
Yes, fine. You can go
Okay,
ahead.
sir.
Okay,
Yes.
okay.
Myself, Dr. Chhaya Patil. I am working as a professor in Let Mrs. Hosabe Homeopathic Medical College, Nimsargaon, Kolhapur, Maharashtra. Just I wanted to share about the woman life. That is the one phase in woman life is a menopause. Actually, menopause is a physiological condition. So in short, we will see what are the phases and hormonal changes, how takes place in a, how exactly it takes place in a woman. So woman passes through the different phases in her life. That is as a related to the hormone plus and minus. Start puberty, reproductive age. In a reproductive time, pregnancy, delivery, lactation, and then at the end of reproductive life is a menopause. So in each phase of her life, she shifts from the she brings the hormonal shift that influences emotional, cognition, and physical body. That is a major change that takes place. Now we will see the what exactly menopause is. Actually, menopause is a physiological change, and menopause is a very turning point in a woman's life. That is a very important thing in her life. So at this point, just I wanted to share one small story why I wanted to study this menopausal syndrome or the importance of this phase in human life. So once I was in a one of my lecture was arranged in a academic college as a physics graduates college. That lecture was for the menses, menstrual cycle, and menstrual disorder for girls of physics department. So when I was narrating about the normal changes or disorders of the menses, so I completed my session, and at the end, as the reproductive age ends, I began to describe the emotional phase of menopause. Related to that, about the anxiety, irritability, mood swings, insomnia, emptiness feeling, loneliness, etc. I started to narrate. And in short, I just checked the expression, the invitee. I was there with the call of HOD of the physics department. Uh, she was around age of 45, 50. So sudden of I observed there's a lot of change in her facial expression of her facial expression. And she broke down in her tears. What I felt, she was actually HOD. Under her, there was a 10 to 12 staff, teaching and non-teaching, was working. She was very good in academics, everything, educated, all balance and all, as a superior look. But that time, what I felt, my words had unknowingly mirrored her own troubles. And I realized this topic is not a just theoretical thing, but deeply personal, related to emotions. For me, that day became a reminder that when we speak about menopause, we are not just teaching physiology or their disorders. We are speaking directly to the inner lives of a woman sitting in front of us. Many women around us may be carrying similar emotions, and they deserve understanding them instead of just judging them. Okay, this was a small story why I wanted to express it in front of all of you. Okay, so just now we will see, okay, what is exactly menopause. So menopause is a end of reproductive session. It merely means permanent cessation of menstrual cycle, and that happens because there is an exhaustion of ovarian follicle that present in a two ovaries, right and left ovary. So when we declare menopause, when there is a consecutive 12 absence of menses, and around it usually takes place as a physiology around 45 to 50 years of age. Actually, menopause is another disease when it goes as a normal thing. Majority 50% women completes as a physiological thing, but nearly 30 to 40% women lead to some complication. They are not able to cope up whatever the changes takes place during menopausal phase. The related two terms related to this is a perimenopause and climatic. The one mean the same actually. Climatic age is a period around menopause. That is a perimenopause. So perimenopause is a transitional phase of 3 to 5 years. In that, lot of changes takes place. As there is an exhaustion of ovarian follicle, no more ovarian follicles are present in ovary. So there will be no production of estrogen. Okay, and estrogen is a body is used to action of the estrogen. So there will be a lot of changes as cycle becomes irregular, ovulation may takes place, or the hormonal fluctuations is a very common, fluctuates plus minus, and because of all these sessions she gets hot flushes, feeling of warmth, burning sensation, mood changes, sleep disturbances, and lot of things woman experiences at this phase. These symptoms are divided as a physical symptom, mental or emotional symptom, and urogenital symptoms. In three phases, we study these symptoms. The next time is the postmenopause and aging. What exactly it happens? Postmenopause begins after once there is a stoppage of menses for 12 months. Then we are going to declare after amenorrhea for 12 months. So this is a low estrogen state in which bone loss, major changes takes place as a bone loss. This usually happens in a when the patient leads to syndrome, disorder stage, bone loss, cardiovascular diseases, or urogenital atrophy, and that symptoms may start. At what hormonal changes exactly takes place in a menopause? The ovarian follicle pool declines. As exhaustion of ovarian follicle, there is a less production of estrogen and progesterone. Okay, and because of this less production of estrogen, there is a negative feedback mechanism to hypothalamus, which is going to secrete GnRH, and which is going to stimulate pituitary for the secretion of FSH and LH. Initially, that pituitary gland is going to cope up with the situation and elevation of the FSH and LH, and so body is not able to cope up with, as there is a deprivation. So there is a transition period of relative estrogen excess. May body is unable to cope up with that particular situation, and patient may land in some complication. So this is what exactly how hormonal flow goes on, starting from the hypothalamus, pituitary to ovary. And these hormones are going to act on the uterus, endometrium, innermost layer of uterus. So in a perimenopausal phase, that is a climatic age, when there is a drop down of why ovarian follicle exhaust or there's a finish up, as only 350 to 400 ovarian follicles are present in both ovaries. And it definitely when the reproductive age starts, reproduction phase starts with the puberty around age of 12 to 13 years. Definitely that is going to finish up 350 to 400 ovarian follicles are going to mature every month, and they are going to finish around 45 years of age, 45 to 50 years of age. So menopause, usually menopause takes place around 45 to 50 years of age. So when there is exhaustion of ovarian follicle, definitely that will lead to non-functioning of ovaries. So secretion of the estrogen progesterone stops, and that will lead to serum estradiol falls down. How much it falls down? Normally it is a 50 to 300 pgml, and in a menopausal phase it goes to 20 to 10 to 20 picogram per milliliter of level. Okay. If the female is at healthy level, she is a mentally strong, physically fit, and she is not having any stressors related to the work, related to the family, related to the finance and everything, she will lead her normal menopausal life. There will be no any problem. But if she is accompanying with some physical problem, this other systematic disorder, mentally she is not calm, quiet, or healthy. She's having some stressors related to the work, related to the job, or related to the family, children's, husband, and other family members. So definitely she is going to land in this menopausal syndrome problem. FHS in this phase, body tries to cope up for some time, but it's not a possible. Okay. Why that patient gets symptom of what exactly tissue effect of estrogen deficiency takes place. Estrogen deficiency leads to cyclical. Actually, as there is a level of estrogen drop down, definitely body is going to present with the whatever the changes are going to take place, because estrogen dependency are there in a previous life as a reproductive life. So there will be atropic changes. These atropic changes are going to take place in the vagina as a genital organs, female genital organs, breast, skin, and a bone. Because in a calcium metabolism, role of estrogen is a very important. Loss of collagen, elastic fibers causes skin dryness, wrinkling, and sometimes she gets aches and pain. Bone material density decreases, increasing the risk of osteoporosis. That is related to the joint pains and everything. Other major problem arises, that is a metabolic and cardiovascular impact. Because if she is in a complication, in a problem, her body is not able to cope up with the situation, she will land in a cardiovascular problem. So her lipid profile is going to change in a cholesterol level, LDL and HDL. Okay, definitely during this phase, she may actually menopausal. If she is not continue with her exercise, diet, and everything, 100% she is going to get central weight gain. Deposition of fat is a very common, and she may develop insulin resistance, and she may land in complication of diabetes mellitus. So for this everything, lifestyle factors such as high sodium diet, lack of exercise, smoking, alcohol, or some stress. Very important part are the stresses. She is in a tense condition. She is not at a calm level. This is a very important part that may lead to complication. The why patient gets vasomotor symptoms. The vasomotor symptoms is a hot flushes. Why patient gets that? What is the connection exactly? So that is a neuroendocrine and thermoregulation. Disturbances in this will lead to feeling of warmth or burning sensation that is observed as this is a very common symptom, and a patient also knows as this is a common at this particular age, but unable to cope up with that situation because she is feeling of warmth, feeling of heat, not only in a summer season, but even in a winter, rainy season, she's going to experience it. And that is for a very short time. Vasomotor symptoms are thought to arise from the instability of thermoregulation that has disturbed because of the estrogen deficiency. Center linked to GnRH, which is secreted by hypothalamus. Minor changes in a core temperature can trigger disproportionate vasodilation and sweating. Always burning, hot feeling is always followed by sweating and chill. This feeling is called as hot flush. This is caused increased usually in a case of stress and anxiety level. If that patient is in a episode, is having problem related to the stress and anxiety, and that really correlates with the, uh, how many episodes of this hot flushes he is going to get. Hot flushes typically starts in a chest and face, ex- upper extremity, and it may remain only for the seconds or minutes, always followed by profuse sweating and chills. Usually, even this is a very common at night time. Even that patient is in a sleep, and definitely that is going to cause sleep disturbances. And this excess profuse loss of your profuse sweating will lead to exhausted and emotionally fragile. And she is a very sleepless because of this condition. Sometimes she presents with a palpitation. And whenever that patient gets palpitation, she definitely thinks something abnormal with her serious. The triggers that include stress and all is a very common for hot weather, spicy food, caffeine, alcohol, and all the common. Commonest symptom that patient gets is a muscle and joint complaint, aches and pains. In other words, we say as a aches and pain. So, action of estrogen deprivation leads to this complaint. That is a musculoskeletal pains, aches and pains. This is a very common, but this is not related to the Exuly syndrome. But if the patient has a normal physiological changes in menopause also, so that counseling is a very essential. We have to narrate that patient. Otherwise, she will go for the X-ray, CT scan, MRI, and all to detect what exact cause she is having, whether musculoskeletal abnormality she is having and all. Exactly, and there is a changeability of symptom is a very important part. She may be having pain in upper extremity. Next day, she may be having a lower extremity pains and all. And these correlated with the reduced physical activity, vitamin D deficiency, calcium deficiency, and changeability, mental irritability is a common thing. So homeopathic medicines are having great scope for this to treat this condition. Next about the skin and hair, that is a look. Female is a very fond of her look. And loss of reproductive life, your reproductive beauty is a very important part in this. So because of estrogen effect, loss of estrogen effect, skin definitely dry. Sometimes she may get pruritus as itching with reduced elasticity of skin. Formication as a crawling sensation, tingling sensation is also very common. Only dry skin leads to she's a loss of elasticity leads to this feeling. Okay, hair thinning means scalp hair are thin, but she can maintain it with the proper diet and all. She can get rid of this. Okay, or abnormally she may get facial hairs as hair growth at beard side or mustaches like. This is because of abnormal hormone secretion. Ata, when we think about this, whatever we are discussed of the physical symptom, irritability, anxiety, and all these are the mental symptoms, your emotional level. Third very important part is related to the genitourinary symptom that patient gets in a menopausal syndrome. So why that symptom occurs in a genitourinary is a urogenital atrophy contributes to the frequency, urgency, and nocturia, stress incontinence. Not in each and every patient. So very important cause behind this is a pelvic floor weakness or that pelvic floor muscle weakness is a very important part in this. So muscle strength has less, so she may undergo this problem. So frequency or urgency, there is a that leads to the sphincter problem, urinary sphincter problem. She may get in this complication. Urgency is a very important part. She cannot control when she get a urination sensation. She cannot control. So and next, this is related to the urinary complaint. And the second common is a prolapse. That is herniation of pelvic organ through vagina, and it causes same as pelvic support weakness. Indirectly, that goes for the muscle weakness. Okay. Sensation of feeling heavy pelvis is also important. Next, sexual relate to the sexual function and body image. Declining estrogen reduces vaginal lubrication and elasticity. Dryness of the part is a very important part. So she may experience dyspareunia. Dyspareunia is a painful sexual intercourse that may lead to avoidance of intercourse. Next thing, she may think in negative self-image as obesity, reproductive beauty, and all. Fear of aging and relationship conflict may further diminishes sexual desire. For this purpose, open discussion about the sexuality, not only with that female, but with that couple, that is a very important. So counseling will play very important role in this. Psychological symptoms. In psychological mood swings, sometimes she may be very happy, alternate she may feel very sad. Weeping disposition is also very common in this. Irritability. And this comes in episodes. Low mood, feeling uneasy, feeling lonely is a very important part of this. And she is going to experience this all the way 3 to 5 years. So this is a great period, long period. She is going to get it. Sleep disturbances, maybe because of irritability, anxiety, fatigue, feeling very weak is also very much. Poor memory, that is also. And the female who is a main important person of family till the age of 45, after 45 she may be feeling lonely, no importance at family and all. That is a very important part. Midlife means in this menopausal phase, what responsibility female gets, means why this symptom occurs, she may be having a multitasking. In short, elderly parents, she has to take care of elderly parents, that may be in-laws or her own parents, handling work responsibility. As age-wise, definitely she is going to get more responsibilities at job place or work. Managing adolescents or adult children, means in a school life, they are very close to mothers. But once they enter in a college teenage group, definitely they little bit detached from the mother. And that feeling, that adjustment is a very problematic to adjust with that situation for that mother. So that is an empty nest feeling. Empty nest feeling is what? Feeling loneliness. There is no importance. Or at around 45 to 50 age, what happens if she is having a son or daughter? They may go out for the job or education from family. So her life was if she is a housewife, her complete life was around that family, around her children, till age of 40 years. She's taking care of everything. And sudden of, there is no work for her when they go out for job or for education. Or even though they are at home, at present situation is that everyone is busy in a mobile, so they don't have more time to discuss whatever the problem that female gets, that mother gets. Okay, and because of this, she feels emptiness syndrome. Emptiness syndrome is a feeling alone. There is no importance at family, and definitely the life partner, as age wise, definitely will get more work, more responsibilities at work. Definitely detached, little bit detached from the family. That leads to feeling of emptiness syndrome, that provokes grief, loneliness, and where is my own identity? What is the importance to me at work? That feeling she gets. That is a very important part. For this condition, counseling is a very essential part. So be she has to engage herself in her hobbies, whatever things she has. That is a very important thing. So counseling is a very essential thing for that. So whatever the symptom that patient gets at physical, somatic level, psychological, mental level, and at urogenital. Urogenital symptom as related to the sexuality and urinary complaints, even related to the other pelvic floor disorders. So whenever we think of the conventional therapeutic option, what happens? What modern medicine is going to give for this is a hormone replacement therapy. Actually, as a physiology, hormones are not needed henceforth. This body is a role of estrogen, progesterone, FSH, LH is not there after age of 50. But so externally, if HRT is given, that is hormone replacement is given as per the conventional therapeutics, so the modern medicine. So and we don't know the quantity of requirement what required to maintain her health. So that may lead to complications. So hormone replacement therapy is often prescribed to relieve. Definitely, this will give relief to vasomotor and urogenital symptoms. They may prescribe only estrogen or combined estrogen progesterone. Instead of what complication that patient will get because of HRT, that we will see. Risk and benefits of HRT. Definitely, HRT is given, that is going to help to relieve temporary relief of this symptom. Patient will be happy. Whatever the trouble she is having, she is fine with that. But HRT can improve bone density and reduce fracture risk when initiated near menopause. So that is a positive thing. But she is having problem. Long-term intake of the HRT hormonal tablet for these changes may lead to breast cancer, cervical cancer, venous thromboembolism, stroke because of use of long-term this. So whether to advise HRT, instead HRT is not essential and body never demands. The hormones are not essential in this particular phase. So what we are going to advise? What we have to advise? Otherwise, what she has to do for this? So homeopathic medicine are the best option because we are going to cure whatever the cause started from the psychological level, that is a mental state, and whatever the symptom we are going to observe at the physical level. So homeopathic medicine definitely we are going to prescribe, but with this change in lifestyle, why she has landed, even though the menopausal change is a physiological, why he landed in that syndrome, why she is having this syndrome symptoms, that we have to check. Miss, she is not a mentally fit, she is not a physically fit, so she has this problem. So definitely with homeopathic medicine, 100% we have to advise her about her exercise, change in lifestyle, plus in whatever the rich diet. Diet is a very important part. So deficiencies arises because of wrong diet. So diet rich in fruits, vegetables, whole grains, protein, that will support to get physically fit. Okay. Regular weight bearing exercises. According to the at that 45 to 50 age, according to this only we have to advise her. So walking, that should be more than 45 minutes. Yoga, she can perform, or she can perform the exercise that she can bear, or she used to it, whatever she knows or she is following. Resistance training preserves that will definitely help for the bone and muscle. For mental level, mind body practices including meditation, breathing techniques, meditation, pranayam, that helps strong mind, and that will lead to strong mind and can reduce anxiety and improve her sleep. So definitely what to advise, very important, she has to. So very important thing, in other word we can say, she has to give importance to self, own health. That is a very important thing. So she has to give importance to her diet. Otherwise what happens? Definitely whatever cooked at family, means whatever the diet or the food prepared at home is totally in her hand to decide what to prepare and not. But what happens? Many times she provides good thing for family members, but she is not taking proper care of self. So that has to be changed. So she has to take proper nutrition. Otherwise, now I am at a 45 to 50, so there is a no need that attitude may start. So we have to counsel her about her diet for physical fitness, for mind, mental, this peace, your calmness. She can go for the meditation, exercise, and all. And definitely that will help to reduce her irritability, anxiety, and that will improve her sleep. Even vasomotor symptoms are going to reduce as hot flushes. Role of counseling. So counseling is a very important part in this. When we think about the counseling, so counseling is only not only important for the that person, that patient. So psychoeducation about menopause means we have to explain what are the menopause, why these symptoms she's a get, what exactly cause behind that. So course of menopausal syndrome means what is the wrong with, what is the exactly causative factor that we have to review. So couple counseling, family counseling is also very important because her disturbing cause may be related to her family, her son or daughter. So counseling to them also needed in such a way. Couple counseling may help address relationship strength, sexual difficulties. Support group offers shared narratives and can complement individual homeopathic treatment. So definitely we are going to give medicine, but counseling role is also very important. Whenever we think about the integrated thing. Means when this is a role of homeopathy, we are going to see. But whether she is healthy with her gynecological condition, we have to take that care also as a role of gynecologist and if required, psychiatry. Otherwise, depending on homeopathic this, we are going to 100% result. As homeopathy considers disease as a dynamic disturbance of the vital force rather than a mere tissue change. So menopausal syndrome is viewed as a psychosomatic expression of this disturbance in a particular life phase. Particular life phase means at the age of around 50, 45 to 50 years of age. So homeopathy is having great scope at each and every. Whenever we think of psychosomatic expression, psychosomatic disturbances, so origin is from the mental level as our homeopathy believes, and symptom appear related to the physical symptom. So homeopathy is the best option with counseling, with diet and exercise. So definitely Mater Medica, repertory and organon philosophy are going to help in this. So proper documenting of the case plays very important role. So record keeping. So whenever we think of homeopathy, complete case taking of homeopathy plays very important. So in that we are going to cover everything as a starting from the bringing up, because past histories plays very important role. Many of the patients starts with the at present she is a fine at healthy level, but the past grief, past anger that may provoke present situation. So history taking plays very important. In my this study, I have used menopausal rating scale is a one scale to differentiate the or to understand the role of homeopathic symptoms. So what is exactly menopausal rating scale, MRS thing? So there are 11 symptoms are considered in this scale. Symptoms of mental level, physical level, and urogenital symptom. Whatever symptoms previously we have discussed, these symptoms are considered in a menopause rating scale. So these symptoms are marked as a there is a no complaint 0 to 4 grading are given to this symptom as a 0, 1, 2, 3 means depending on the severity of complaint. So I'm going to, while history taking, I'm going to use this scale. Whenever patient presents, I am going to give this rating. And total of this scale means whatever the symptoms she is having, that 11 symptom of 3 conditions. Whatever the total counting I am going to get, I am going to compare with the before and after treatment. So I can judge whether the what is the after treatment, what difference I get. Means after 1 month or after 3 months or 6 months, depending on the role of homeopathic medicine and how the medicine acts and suitable for that lady. When she feels better at the end of treatment, I can again get this symptom rating. So menopausal rating scale I'm going to use. And again, there is a 11 pointer will be scored. So total of first case taking and after treatment, before treatment and after treatment comparison will help to get conclusion whether she has cured, she's fine, or she need other condition, means whether she's lacking, means what changes has to do in a this. So next thing, what are the common remedies for menopausal syndrome? If the patient presents with the symptoms, there are some common homeopathic remedies that we will see. So we know graphitis in menopause. Graphitis usually is a very important remedy for skin complaints. A very important feature graphitis cover is a menopausal complaints. Hello.
Yes, ma'am, you are audible.
My slides are open. Yeah, slides are visible.
Yes, ma'am.
Just wait. Yeah. So just we are related to the what are the common remedies? First one is the graphitis. So just only the key features of the remedies I am going to discuss. Graphitis women are typically chilly, sluggish, slow comparative, prone to weight gain at menopausal age. Skin findings includes dry, rough, fissured area. Fissures and cracks are the very common. That is with the honey-like oozing. Dull, drowsy, daisy. 3Ds are important part of the graphitis. Poor concentration related to the memory and hot flushes it covers. Okay, that is a graphite. Next is a laches. Laches is suited to intense climatic state. Laches is the all complaints started in menopause. It's a keynote feature of laches. Just like a pulsatilla comparative, all complaints since puberty, laches covers all complaints since climatic age or menopause. So laches is suited to the tall dark woman, congestive hot flushes, and palpitation is a very important. It covers. Complaint often worsens before menses and improves once flow starts. So patient feels better by bleeding. Bleeding phase starts in a menstrual cycle. Mentally, the woman is a very talkative and jealous, suspicious is a very important part. Intolerance of tight clothing around neck and waist. So, like I said, we can't forget in this field. Next thing is a sepia. Sepia is a worn-out mother. As we know, keynote feature of sepia is indifference. Indifference to loved one. When the woman feels emotionally detached from her family, as they are very loved ones, on sudden she may feel ki she is not connected with the domestic duties and all. Physical keynotes covers bearing down, prolapse. This is the best remedy for prolapse. So bearing down sensation, she crosses her legs. This is the PQRS of sepia. Okay. Sepia is the best for all varieties of menstrual disorders. Sometimes patient may present with a scanty or sometimes with a heavy bleeding. With irritability and wanted to be alone. This is a sepia, worn out mother. Next thing is a sulfur. Sulfur, it's a keynote. Sulfur is a burning heat. And mentally, patient is a philosopher. In short, we can say as a ragged philosopher. Sulfur woman often experiences intense heat. That is whatever we have seen the hot flushes, burning, feeling of warmth. Usually early in the morning, and the patient prefers to uncover. Hot flushes, burning sensation of vertex, palm, sole, messy habits are common. Patient is a very intellectually high level, eccentric and worried about the health and reluctant to follow routine as a philosopher. That is sulfur. Next one is calcaraca. Calcaraca, fair, fat, flabby lady, suits responsible, hardworking woman who feels overburdened and easily extorted. Look wise, she is a very strong, but actually strength is not there. It's a very weak. There is a tendency to chilliness, blooding menses. Menses are very profuse. Night sweat, weight gain. Weight gain as a flabbiness, fattiness is a common thing. Joint stiffness, leg cramps, marked anxiety about health, finance. That is a very important part of calcaraca. Pulsatilla. Even though pulsatilla is the best for the puberty age, even pulsatilla is well suited to menopause. Soft and changeable. Always want company. The pulsatilla. Pulsatilla woman is a gentle, yielding, emotionally dependent with strong need for affection. Weeping tendency is a very important part of this. They suffer from changeable symptom. What we see in the menopause is a pains and aches here and there. That is a keynote feature of pulsatilla. Irregular periods, even best for the leukorrhea, shifting pain, alternating heat and chill. More pain, more chill. It's a keynote again. They dislike stuffy rooms, so always we feel better in a fresh open air. And it's thirstless remedy. Pulsatilla. Next, very important one is ignatia. That is a grief and contradiction. Contradiction is a keynote. Ignatia is considered when menopausal symptoms follow grief, history of grief, disappointment, or emotional shock. Woman may present with a shine, globus hystericus. So, when we think of the psychological disorder that is at a prominent level, then we can think of this remedy. Rapid, but this grief and this sadness alternates with laughing and crying. Headache is also there. Spasmodic pains, irregular menses, intense inner sensitivity. The ignition. Nitromute, the introvert patient, reserved and hurt, always in grief. Okay. Natrum muriaticum fits reserved woman, introvert. She is not able to express her feelings or suppressed anger also, or there is a unexpressed. Her anger is not expressed or feelings are not expressed. Fits reserved woman who dwells on a past hurts, feels unable to cry openly because as she is not able to express her feelings, they may have migraines, backache associated with menstrual irregularity. Craving for salt is a keynote, aversion to consolation, aggravation from heat as a sun exposure aggravates. The keynote of natrum muriaticum. Staphysagria. Yeah, staphysagria is a suppressed anger. Because whenever the patient presents with the menopausal syndrome, past symptoms, her past feelings plays very important role. And this is a very important part. So whatever the symptom at present she is suffering from, maybe the past. So there is a suppressed anger in staphysagria. Staphysagria is useful where long-standing suppression of anger leads to depressive mood and sudden outburst. So she's not taking part in any important events and all. She used to be alone. Menopausal woman may report past humiliation, abuse, and domination by the partner. Feel, she feels insulted in her past life. Physical complaints include genital itching, urinary irritation, headaches. They are the common in staphysagria. There are so many remedies, and anyhow, whenever we prescribe on the constitutional base, there are so many remedies we can get. Belladonna. As for the symptom, I have written here belladonna, glonine, Lunius, creosote, sorinum. Many remedies are there that we can prescribe depending on the totality. So, totality depending prescription, depending on the totality, plays very important. Okay. So, multiple observation studies report benefits. Homeopathy, whatever my observation, whatever the cases I have seen, multiple observational studies reports benefits of homeopathy on vasomotor, psychological, and musculoskeletal symptoms. Means homeopathy is applicable everywhere. Case reports illustrate successful management of complex menopausal presentation using constitutional remedies. I have seen already we have discussed about the menopausal rating scale. So there are 11 items we are going to count and we are going to score depend 0 to 4 as depending on the there is no symptom to severity of symptom. Symptoms we are going to count from the somatovegetative as a physical symptom, psychological is a mental symptom, and erosion item. That symptoms already we have discussed. So and depending on the symptom, all symptom is not observed in a single patient. Definitely, individualization is a very important part. So one female is going to get some symptoms at physical level, so other may be getting at mental level. So scoring makes a lot of difference. So this scale is a very useful and it helps to get a conclusion at the end of treatment. So next thing, 2-3 cases just I wanted to discuss. There are 2-3 cases are there. So whenever we think is, but one more concept I want to clear before starting off these cases. All females are not going to get menopause at age of 45 to 50. Some may present with a premature menopause. Premature menopause, attending menses, menopause, there is stoppage of menses before age of 45 years. So that is called premature menopause. One more thing is a surgical menopause or artificial menopause also. Because of some condition or some menstrual complication, patient may get operated for hysterectomy, removal of uterus. In such condition, usually whenever she is in a reproductive age, your ovaries are retained, ovaries are preserved. That is a partial hysterectomy. But that will not help for a longer time. Only that will help for 2 to 3 years. And after that, definitely she is going to land, after 3-4 years, she is going to land in a menopausal phase at whatever the age hysterectomy has done. So there are 2 terms. So now we will see the case. So sulfur. Instead of giving name, just I have given the remedy given. So this is a 49-year-old school teacher present with a 2-year history of irregular menses. So one more irregular menses leading to amenorrhea. Means that there is a phasic change in her. Usually she get menses at 2 months, sometimes 3 months, irregular. Cycle are not fixed. And what she feels because of her menopausal age, she may be getting this. But over the last 6 months, she reports 6 to 8 associated with hot flushes. That is intense heat feeling followed by sweat. And uneasy feeling, feeling weakness, palpitation, early morning or sleep disturbances was the keynote in this. Mentally, she is a very intelligent. As a academically, she's a good. She's hobbies are reading, but what she feels ki I don't give importance to keep everything fine. Arrangement is a not proper. That what she feels worse in a warm room, pros of covering at night, complaints of burning feet. Depending on totality, I have prescribed sulfur 200, instructed for the diet, hydration, yoga, meditation, and sleep hygiene. Definitely, she has to take care of her sleep. Some exercise are must. Only sulfur will not help. So after 2 to 3 cycles, after 2 to 3 months, she was improved, and the physically score was initially her score was menopausal rating MRS score was 35. That came to around 20 after 3 months. That was the result. Second case, Sepia, 46-year-old homemaker complains of heavy. She was a housewife, heavy irregular periods, followed by months of scanty bleeding. Actually, one misconception is there. Housewife, they are not means if they are not related to the education or this, what they feel during menopausal age, usually they get excess bleeding. But actually, excess bleeding is not expected during menopausal age. Menses should be scanty and irregular. That is expected as a normal physiology. She experiences constant bearing down sensation in pelvis, worse standing. There is a vaginal dryness. She feels emotionally disconnected. I have no value at home. That was the feeling. What that is, we discussed about the emptiness syndrome. So, and what as weakness, feeling of exhausted. So, domestic duties, she feels that is a burden for her. She prefers solitude, living alone, not giving importance to all, and don't want to mix in all. So, Sepia was selected as a prolapse. Actually, prolapse was not there. Only she was having sensation. Pelvic heaviness was there as a muscle weakness and all. Counseling session helped her. She was reluctant about exercise and all. But result after 6 months, she was a fine. There was no much complaints. Okay. These are the two cases. Next thing I will see, there are 2, 3 cases, but directly I want to proceed for the practical pulse for clinician. Always rule out. Very important whenever we think of the menopausal syndrome. In some cases, we may get thyroid dysfunction. In some cases, there may be complication of cardiac disease because cardiovascular disease are very common at this particular age. And next, very important is a malignancy that we have to rule out. Only considering as a menopausal symptom, and because of that, she is getting palpitation. Because of that, she is getting PV, excess profuse PV bleeding should not be considered. Definitely, we have to rule out other important pathologies, whether she is having. And other important, if she is not having these complaints, then we can continue with our menopausal course, history taking, prescription, homeopathic prescription depending on this, other advices, and definitely we will get result. Importance, wherever necessary, we have to take advice of gynecologist, endocrinologist, and this is a very essential. Okay. Importance of homeopathy, that already we have discussed till now. Summary of key concept. I'm at the end. Actually, menopause is a 100% physiological milestone with multifactorial symptomatology requiring holistic understanding. Whenever that patient, if she is not having any symptom, no treatment is required. But whenever she is having only related symptoms or she is disturbed because of the menopausal condition, definitely we have to prescribe her. Homeopathic management combines individualized remedies, lifestyle guidance, empathic listening. This is my last slide. Thank you for your attention. Questions and discussions are welcome. Together, we can improve the quality of life of women experiencing menopausal syndrome through thoughtful homeopathic care. This is a need of, actually, this is condition, this is a need of society, expecting I am expecting everyone to take care of their life partner, sister, mother, mother-in-law, or any woman in family and their friends. Thank you all.
Thank you very much, ma'am, for such a wonderful, informative, and research oriented presentation. Your clear explanation of menopausal syndrome, along with the clinical approach and finding from your experimental study, has greatly enriched our understanding. We sincerely appreciate the time, effort, and valuable insights you have shared with the IFPH family. Now we
Thank
shall
you.
begin the interactive question and answer session.
Okay. I was welcome.
Yes, Madam, as rightly Dr. Winkle pointed out, it was really an excellent session, and the methodology of the practice is really excellent, and choosing the right medicine, even sulfur can do wonders.
Yes. Thank you. Definitely.
Most of the people have a prejudice view that sulfur cannot be used in these circumstances, but it
The
can be used
totality is there.
when the totality is there, you can use it. And so, as Dr. Hanneman pointed out, that you must be an unprejudiced observer, just like that unprejudiced prescriber also. So
Yes, yes.
never think that sulfur will do damage or graphitis will do so much damage to the patient. So I won't prescribe damage this sulfur or graphitis to a particular patient. Sometimes the skin complaints or it may whatever be the complaint that may be that may get worse, but actually it is not. If the medicine is, if the simillimum is the right medicine, it will work. There is no, there is nothing to worry about. You just go ahead. That's what you have shown in this session, and really, this kind of presentations are for the need of the hour, because we will have to prove the world that homeopathy can do such wonders with our homeopathic medicine. People believe that you will have to consult a gynecologist for all those things, but most of the people that they are coming to us are really coming after consultation with some of the famous gynecologists around the world, particularly in India. But the thing is that most people are not aware about that homeopathy
Yes.
can do
Still, the
things.
patients are not approaching, sir.
So
Exactly.
it is our duty to take homeopathy to expose what is homeopathy, and show the world that what we are doing and how the cases are being treated, and how one can win over any other system without damaging your personal health. So that's what I would like to add. One sir want to talk, Dr. Unga, you can call. Pandey sir? Oh, there was some, sir was there. And Dr. Sheila, do you want to talk?
Am I audible, sir?
Yes, sir. Yes, sir.
Madam has presented nicely, and all the things that have been discussed, they are very useful for day-to-day practice. Actually, because of the mood swings, some ladies they cannot adapt to the situation and go to the depression stage. So, madam, how can you handle when the lady is suffering from menopausal depression? That may be major or minor, whatever it may be.
Actually, whenever we are not good, if that in that phase, if that patient is not going to approach us, is a very difficult thing. They should understand the situation. Means they need assistance for this, for homeopathic treatment. Counseling is essential. That should be understood by the patient. And for this, I think just like the government is taking seminars, workshops for the puberty changes, just like that, if you take for the menopausal disease, menopausal conditions also, definitely this will help. We have to promote for this situation. That is very important. So I have related to irritability, suppression, this I have anxiety and all I have explained. But depression is also that much important. Depression also that some patient may go naturally patient as an introvert patient may land in depression.
Yes. Sir, can you hear? And Dr. Jain? Jayanti, you want to stop? Dr. Jayanti, you can unmute yourself and speak. Dr. Sheila?
Yes, sir. Very good evening, all.
Yes, 1 minute. Yes. Yes, you can speak.
Yes, sir. Yeah, very good evening, ma'am. So it was really a wonderful section. You explained it very clear about the menopausal syndrome and all the medicines which can be used for all the polycrust, I think. So it will include sulfur, natramo, sepia, pulsatilla, graphitis, lacus. All these medicines are polycrust. I think almost all the cases can be uh, included in this menopausal syndrome also. So thank you so much, ma'am. It was really a wonderful section and we already enjoyed it very well. Thank you, ma'am.
Thank you.
Actually, madam rightly said that the patient are not aware. So
Aware about the situation, really.
we need to arrange an organism
Awareness, yes. Society awareness is essential.
In the rural area, those who are not aware about the physiological menopause is physiology, so they are not aware about the physiological transition. So program should be made in school level, in village level, to make our ladies aware that this is the normal thing. We have to accept it. We have to adapt it. And those ladies who are not able to adapt it and inferiority complex, we have to make them aware, and the medicines we should prescribe as per the totality, as there is no scope in other conventional medicine. Am I right, madam?
Yes, exactly. This is the need of society, sir.
Thank you, madam.
Yes, Dr. Ambaresh, sir, you can say vote of thanks also.
Thank you, Dr. Thaneji. Congratulations, Dr. Chhaya Patil, madam.
Thank you, sir.
Very nice and very information session.
Thank you, sir.
Menopausal syndrome and case presentation is very good. And many kinds of describe the according to symptom homeopathic medicine, sepia, natamute, sulfur. So menopausal condition, it is normal condition, it is physiological condition, but some ladies depression like
they're not able to cope up.
fever like symptom. So very thanks, madam, behalf of IFPH whole team. Very thanks again presentation. Thank you. हरघर होम्योपैथिक हरघर होम्योपैथिक
Yes, sir.
बनता रहे होता रहे. Thank you.
Thank you, sir. Thank you.
Dr. Winkle, you can conclude the session.
Thank you, sir.
As we come to the end of today's academic session, I extend my sincere gratitude to our respected speaker, Dr. Chhaya ma'am, all the participants, organizing team, and the entire IFPH family for making today's webinar a great success. If you found today's session valuable, we encourage you to subscribe the IFPH Homeopathy YouTube channel, where recordings of the most of the previous webinars are available and learning and reference. Your support help us continue this remarkable journey of uninterrupted daily academic webinars. Thank you once again for your presence and participation. Have a wonderful evening. Stay healthy, keep learning, and keep promoting homeopathy.
Thank you.
Thank you, Dr. Rinkel, Dr. Chhaya, Dr. Vibhu Prasad Pandey sir, and Dr. Ram Barash sir, and those who attend the English session. And tomorrow we will have a session from Dr. Snehal Deepak Chaparia. And Dr. Will is a professor and the Chodi FMT late Osbai Medical College Hospital, Kolhapur, Maharashtra. And she will be talking about medical ethics role in enhancing patient care. Hope all of you will join us tomorrow at the same time. Thank you all. Good night.